And Sharon and Minister, you're very welcome into the Chamber this afternoon. And I too, along with my colleagues here, are delighted that this bill is progressing through this House. So I'd like to draw attention to the first section of this bill, which states that this national treatment is to be established for the timely and effective inpatient and outpatient treatment of scoliosis, and that it will designate hospitals and other facilities for the timely detection, assessment and remedial treatment of scoliosis. The emphasis here is on the word mentioned twice for good measure: timely. Over the past years, we have been treated to one horror story after another of waiting lists and their impacts on patients. Previous governments and health ministers have promised to reduce waiting lists and the numbers of people on those waiting lists. But while those promises may have been made in good faith, it is apparent that it has failed to materialise. Therefore, it is imperative that the state step in to take a greater role of oversight and to ensure that we deliver the healthcare our citizens pay for, the healthcare they deserve and the healthcare they need. But again, I would like to return to the word timely. Today, a mother from Donegal agreed to share her story relating to her daughter Jamie McGinley to highlight the shortcomings of our current system. Young Jamie has been lucky in that her family managed to find treatment for her in Turkey, although the fact that they had been forced to due to the lack of timeliness in this healthcare system is shameful. The lack of timely provision of treatment in both our public and private healthcare sectors, and the fact that this has forced a family to seek solutions abroad at great personal expense to themselves, is just another example of a wrong we urgently need to right. At 14 years old, Jamie's medical check-up found her condition was not urgent or serious. However, a year later, at the age of 15, she was told in Crumlin Hospital that she would lose function of one of her lungs if she did not receive surgery as soon as possible. Her time frame for treatment was 6 to 8 weeks. Her mother told us that given her previous experience, such as having to wait 5 weeks for an X-ray and having to go all the way down to Navan for it, and that given the urgency of her case, the best option was to seek treatment in Turkey. In Istanbul, Jamie was able to receive all the tests and the surgery she required in a matter of days. That is a standard of timely treatment, not the months or the years Irish citizens are expected to wait. Waiting times are causing enormous damages to real human lives. One of the consultants who spoke to Jamie's mother told her that many patients often receive permanent damage to their lungs by the time they receive their pre-surgery tests. More generally, Jamie's mother highlighted a broader issue with waiting times, which is that the current system appears to prioritise the more straightforward and simple cases, particularly cases where treatment abroad is needed. Meanwhile, children and minors who have more complicated cases and suffer from one or more conditions, such as Jamie, who tragically suffer from Chiari malformation, in addition to scoliosis, have to wait longer for treatment, as they have to wait on more tests and consultations. This despite the fact that they are very often required treatment more urgently for precisely the same reasons. As Jamie Mothers describes the current system as one where the ones who need treatment the most wait the longest. Again, timely treatment of scoliosis is not only reactive treatment for scoliosis when it arises, it is also preventative treatment. Another young woman whom I met today, protesting outside these gates, Minister, agreed to share her story, was Katie Byrne from Cove in County Cork. Katie has just turned 18. She has cerebral palsy, a dysplastic hip and a twisted femur. Without surgery, she risks hip arthritis, full-time wheelchair use and scoliosis. Katie has spent 14 years, 5 months waiting on surgery. Members of the House, let me just repeat that. 14 years. That's nearly her entire life that she's been waiting for surgery she needs. Katie is given the explanation as to why she cannot receive surgery. She was told she was too weak. She was told that her hip is not dysplastic enough. She was told that she is too young for surgery. Then, believe it or not, she is told she's too old for surgery. At this time, Katie is braving a pain. Her family have been forced to search for treatment abroad and are desperately seeking to raise the money for this treatment. Parents shouldn't have to set up a GoFundMe page to get treatment for their children in this country. That is down to our Minister for Health. That is down to the previous Minister of Health, 14 years Minister. So, members of this House, it is all well and good to talk about timeliness and numbers on waiting list, but we must remember that the horrific delays we here have enormous human costs and can change lives for the worse. Minister, I'm going to send you on that case in relation to Katie, and please, if you could do anything for her to avoid her having to raise this 300,000 to go to America to get treatment, I would really, really appreciate it. Thank you.